When an individual or loved one is going into drug rehab, it's easy to feel anxious to see results quickly. If the individual is going to be attending one of the many drug rehab centers now operating, it's even easier to have too high hopes for a quick recovery. It's important to remember that rehab centers are not miraculous solutions. Just as there is no easy medicinal cure for many ailments, even the most intensive and well-structured programs available cannot guarantee a speedy recovery. The goals of drug rehab centers are as follows: help the individual recover from a dependency on drugs. Keep withdrawal symptoms to a minimum and help the individual remain safe and comfortable. Help to teach the individual healthy, drug-free living skills and coping strategies. 3 stages of recovery. 1. Diagnose and plan. The first step a rehab center will take is diagnosing and planning the course of treatment, sometimes with psychiatric or other medical consultation. At this point, goals will be set, and the patients will learn the nature of the withdrawal symptoms they will likely experience. 2. Withdrawal. This step is the most important and hardest. Aided by the professionals at the rehab center, individuals must now undertake the actual withdrawal. The actual severity and length of the withdrawal symptoms will be different for everyone, depending on the drug, how much was taken and for how long, and several other factors. The centers designed especially for drug rehabilitation are able to handle a wide variety of needs, and some even focus on specific drugs so as to better meet those needs. It's wise to talk to the individuals behind each program to find out what to expect from them in terms of treatment length, the patient's ability to communicate with the outside world, support available for the patient and those close to him or her, and so on. Drug rehab centers are also equipped to handle the many setbacks that some people might experience while recovering. Relapses are common, particularly when the individual is not living full-time at the center, but a relapse or 2, or even more, is not the end of all hope for recovery. 3. Independence. The last stage of recovery is independence. While the rehab centers and medical professionals can help the most in an inpatient setting, where the recovering addict resides full-time in the center, often the next step is the hardest in the recovery process, because they are less well supported than before. After the withdrawal is over, whichever of the many drug rehab centers the individual was depending on are now finished their job. The former patients have to assume independence, using the skills that the drug rehab centers taught them, and remain drug-free on their own. In conclusion, while drug rehab centers can be very valuable programs for any recovering addict, the expectations must not be set too high at first. Many people relapse and have to go through the withdrawal stage more than once. Patience and careful questioning of the center's staff will ensure that expectations are set reasonably by all parties involved for maximum chance of success.